It is also known as single patient or single case randomized trial that evaluate the effectiveness of intervention for individual patients. In this, a single patient serves as their own control, and multiple treatment sessions are performed within that patient to distinguish random effect from real effects. To eliminate bias, treatment and outcome is concealed from patient. Applicability includes chronic condition, intervention that produces transient effect, beneficiary effect should appear quicker. Examples include orthosis for pain management in children and graded activity to manage low back pain. Systemic reviews provide a truer picture of effective intervention than any individual trial and provides precision and size of effective intervention. Types include narrative review. The researchers locate relevant studies and write a synthesis of what those studies have to say, acting as a source of summary. It had a drawback that the researcher have different philosophical orientation. Systemic review. It is the new approach. It provides method used to conduct the review. One example is Cochrane collaboration. Meta-analysis. Initially, systemic review were called as meta-analysis, but now meta-analysis is a part of systemic review. Retrospective conduction, which means review is made after the conduction of trial. Prospective systemic review, designed before completion of trial, but it takes years to complete. Randomized trials and systemic reviews are unable to provide insights into patient experience. Clinical observation. They help in learning patients' experience in many ways, like directly asking the patient's experience. Communication skill of physiotherapist also plays a crucial role. There is limitation to this process, which is time and resource. Thus, we opt for high quality clinical research. It has two types. Questions about experience are best answered by qualitative research. It is useful in study of human and social experience, communication, thoughts, expectation, attitudes, etc. While on the other hand, quantitative research involves the collection of numerical data and utilizes statistical analysis to draw conclusions and make generalizations about the population being studied. How it is done? It is done through interviews, field notes, and open ended surveys. Common areas of research relevant to clinical practice include influence of patient physiotherapist relationship and development of theory. Combining qualitative and quantitative research can also be done. It is divided into four categories. It is conducted prior to quantitative research to set direction for research. It is directly related to clinical decision making. It helps in finding out which intervention is valued by patient and why they do not want to comply with certain intervention. It helps in strategy development for prevention programs like sports injury. It influences how outcome is measured. It helps in learning patients' need. Systemic review. Integration of qualitative research with systemic review is topic of discussion. Cochrane collaboration established Cochrane Qualitative Method Group, which focus on inclusion of evidence from qualitative into systemic studies. It gives insights into internal and external factors. Internal includes professional or consumer behavior, and external like policy development. Prognosis deal with questions related to improvement in patient's condition. Clinical observation. Information related to prognosis is gathered by the physiotherapist during the course of their career. They find out patterns in the characteristics of patients who improve or vice versa. Limitations. Difficulty in obtaining long-term prognosis. Follow-up is done on subset of patient. Number of population should be large. Clinical research. Longitudinal study is preferred for better prognosis, which is patient is observed more than one point at a time. It is cohort, that is the population under observation share common characteristics. Prospective cohort study. It is the cohorts are identified before the follow-up of data. It helps in setting up a eligibility criteria used in research. Retrospective cohort study. The data is obtained before identification of cohort. Clinical trials. It can be useful to generate information about outcome along with effect of intervention, but the trials does not have to be controlled. Systemic reviews. Narrative reviews are prone to bias, but methods are getting developed to conduct systemic reviews on prognosis. Accuracy of diagnostic tests can be checked through clinical observation. Diagnostic tests are performed in routine clinical practice. The accuracy is confirmed through investigation. Example: for rotator cuff tear, O'Brien test is performed, which is later confirmed through arthroscopy. Better examination involves using high quality clinical research. Cross-sectional study of diagnostic tests involves performing clinical tests on a group of subjects and then they undergo another test. It helps establish correct diagnosis, which is referred as gold standard test. Limitation: it is expensive. Example: subjects having sciatica are assessed for lumbosacral nerve root compression. In this, the gold standard test will be MRI. Randomized trial. They tell us about the effect of using diagnostic tests on patients' outcome. For example, two groups are made, one will receive the test and other will not. The results will be compared at the end. Diagnostic test is of two types. First type includes testing of patient when they come up with a particular problem, while the second type is screening. In this, tests are performed on a population with no particular diagnosis. Screening is either practice based, for example, patients presenting with low back pain are assessed for depression, or community based, for example, screening of school children for prevalence of scoliosis. Importance: early disease detection, effective management. Screening program is evaluated with randomized trial. It will help in early detection and improve effectiveness of intervention. Limitations include expensive because they require large number of population. Systemic review. They act as a source of accuracy of diagnostic test. Example: test for ACL, the O2 or ankle rule, test for carpal tunnel syndrome. Cochrane collaboration is an important source for systemic reviews. It includes articles on tests for radiculopathy, red flags for vertebral fracture.